We're going to get right to our very special guest this morning. And many of you have seen this gentleman, this doctor, on a recorded interview with Duke O'Neill. And he's coming back this morning to give us more great information. So I'm going to turn this over to our one and only Duke O'Neill to kick that portion of the call off. So Duke, take it away.
Okay, thank you, Jeannie. Sorry for everybody for the delay getting on, but you know what? We did it. And Ian was gracious enough. He was actually in surgery this morning, so he's made himself available and really, really appreciate it, Ian. Thank you so much for coming on the call.
No, my pleasure. It's great being here and being able to talk with people about what we're all trying to do here with this product regarding the Avicen. It's very important. It's a great technology. So yeah, we just need to share it and get it all going there out into the world, as they say.
Yeah, exactly. Well, just for the people that haven't seen the interview, I'm going to make this very brief, but Dr. Goldbaum is in Palm Beach County, Florida. He's a doctor of podiatric medicine. He's a podiatric surgeon. He's got all the qualifications you can imagine through all the certification boards. He's got a practice, three office locations and over 22,000 patients. And Ian, I understand you were in surgery this morning.
Yeah, I had somebody decided to fracture their foot, so I had to throw a couple of screws in there. So not a great way to start my morning, but you know what? We're able to help people, and that's the job I'm in, so it's fine. I love what I do. You know, that's the whole thing. So yeah, and I was glad to be able to get out in time and be able to get on the phone with everybody.
Thank you so much. Well, one of the things that I know about you, just because I've gotten to know you, is that you are really innovative. You're really willing to look and push the boundaries and check things out. And one of the things that you did that I'm really excited about, and so is everybody else on this call, is that you took some of those Avicen devices and said, listen, I'm going to try these things. I'm not going to say anything about them until I can work with these in my practice for a few months. And you did that. And I know that, the results of that some of that was in the interview, but if you wouldn't mind just sharing with people briefly, how you've used them or what results you've seen with them and the kinds of, things that you're seeing with your patients.
Sure. Real quick, Duke. What I try to do with the Avicen machine, I brought it in. The surgical aspect of it is when we have people post-operatively, there's problems with edema, swelling to the lower extremity. And I found that with the utilization of the Avicen machine post-operative, now remember, I'm a podiatrist. I deal with lower extremity reconstruction. And the Avicen's perfect for me because they have to put one hand on the machine, inside it, into the palm. So I'm not taking off bandages to do this. This is like absolutely perfect for what I needed. And then what we found is when we bring them back in 4 or 5 days for a bandage change, the sutures are all intact and they're not being pulled. Why is that important? Well, it's important for this reason. When you don't have pulling, you don't have pain. And when you don't have pain, you're not taking the opioids, the oxys, the Percocets, et cetera, and so forth. The number of those come down dramatically. Therefore, if you take it a little bit further, because if you take these medications, some people have GI problems, they don't move their bowels as well. I won't get into that part of the medicine of it, but when you can use something like the Avicen device to increase the circulation and bring down the inflammation, it's advantageous to the patient. You have to remember, the thing today is, we're looking at a device, the Avicen. This is where the technology surpasses the medicine. This is the extra thing that we need to have as physicians in our offices to help our patients. So initially I have 3 machines. And we rent, just real quick, we rent our machines in my office for $100 a day. So they'll take them for 5 days, they'll take them for 7 days, whatever it is. And then if they like the machine, because a lot of these patients have other problems besides just lower extremity having surgery. They've got neck pain, they've got back pain, they've got muscle injuries, things of that nature. So now you're talking about different scientific medical entities, problems that the Avicen is now starting to utilize. Interesting enough, I did a reconstruction just the other day on a person's ankle, very big surgery. And she came in yesterday and I said, so how you doing? She goes, I got to tell you, I'm sleeping better than I've slept. I've taken 1 pill. I'm not taking 3 or 4 a night, and my back and my neck don't hurt. I said, well, that's pretty good. This is unbelievable for her, right? And even though she's on crutches at this time because it was a big reconstruction, I said, well, if this continues to go well, you may want to consider obtaining an Avicen machine for yourself because we need to give these to the patients home because they can use it 3, 4, even 5 times a day on a major injury, or if they're
Right.
working out really hard. So in this case, I'm using it surgical, but we're going to have to look at, Duke and Janine, we need to look at this really as a device for wellness. Okay, this is no different than people taking supplementals into their bodies themselves to make themselves better. Once again, technology surpassing the medicine.
Excellent, excellent. So thank you for sharing that. And the results that you've had post-surgery are amazing. Could you share, I want to open this up and open the aperture a little bit and get your opinion on how about the person that hasn't had surgery? I mean, I know we're talking even about people saying, well, I don't necessarily have pain. Do I really need something like this? Maybe share with us what you think a machine like this could do for somebody just on a daily basis.
It's interesting because what are we trying to do? People are going into the pools. They're swimming. People are going to the gym. There's people that are doing chelation. There's so many things that people want to do to be healthier. In the old days, we would make it to be 60, 70, 80 years old. It's not unusual today to have people in their 90s and their hundreds coming in my office. Of course, I'm in Palm Beach County, so it's kind of the age I'm seeing. And they have discretionary income. These people, I mean, they do show up with some of them with their chauffeurs in their Rolls Royce cars, and they want to be out there as long as they can. But they want the thing that you hear, Doc. I want the quality of life. I don't want the quantity. I'm interested in the quality. And that's what I think this machine's allowing us to do. Remember, the Avicen being microcirculation, what's it doing? It's bringing the oxygen to the tissues. It's bringing it to the muscles. It's bringing it to the connective tissue. It's bringing it to the nerves. It's bringing it to the muscles. And what does the microcirculation also do? It pulls away the toxins, so to speak, the carbon dioxide, the lactic acids, those things. That's really the basic, real simplistic of what the microcirculation is. So we're now getting people who are a lot more educated than they were even 10 years ago, and they're finding into their health. They want to know about their health. So they're going to places like salt spas, where they go in and they smell the air of the salt. We have those down here in Florida. We have people, like I said, doing chelation, where they're actually having their bloods taken and put back and filtrate. There's a lot of things going on. This is the easiest machine that I have found out there to give patients maximum, which I feel is a maximum benefit for them, not as a surgical device or a medical device, but as a wellness device. That's the thing that's interesting about the Avicen. That's the thing where we need to tell more people about it, because now you're going into an area that really no one's in. So you have to educate the consumer. And now I'm not going to even call them patients, because now you're talking about consumers. And that's a big deal right now. With everybody, it's a billions and billion-dollar industry. Everybody trying to stay healthy, right? This is an adjunct therapy that they can do at home on their own while they're doing their physical therapy, or they're doing their stretches, or they're going and utilizing the pool, or they're going and doing their workouts. Because when you come back, let's say you did a workout for an hour and a half, right? Now you've got lactic acid in your muscles, et cetera, and so forth. You want to move those a little bit even after the cool down. I think the Avicen machine is a perfect machine for that.
Excellent. Well, I know just for myself, I use it religiously, 30 minutes twice a day. I know the protocol is really only 20. I don't have any specific aches or pains, but I just do it as a matter of course, knowing that I'm dilating my capillaries and getting blood moving. And I want to keep doing that as long as I can.
Yeah, oxygen's the key. And I mean, that's the whole thing. I mean, when you're 16, 17, 21, 22, you can bounce around, you're bulletproof in your mind anyway, right? You start getting a little bit older, you start to realize, I'm not so bulletproof as I used to be. So we look for the edge. Everybody's looking for the edge. Like when I do $1 million ball players, and I've got guys from the military, we'll do a computerized foot scan and we'll see how they're walking, and we'll make them a biomechanical orthotic to get it so that their legs, ankle, and feet are in an anatomical position and get their hips back into a horizontal plane, let's say. So these are things that we try to grab the edge. Well, that's what the Avicen's doing. You're getting more of an edge with it. That's why it's really important. The biggest hit we have is that no one really knows about the Avicen yet, right? But hopefully with New Life Ventures and everybody going out there and talking with people, there'll be more and more people. And then it will just kind of snowball. And then it'll become, kind of like an adjunct, kind of like BioFreeze was back in the day, that started out. Nobody knew what it was, and it took a couple of years, but it was word of mouth really that built that company. So I think with the Avicen and the people that are seeing this right now, how exciting it is that this can become mainstream. It really can.
Right. I think so too. Obviously, we all think so as well. But
or we wouldn't be here, right? That's
that's right. Well, thank you so much. So this basically, from your perspective, could really be, as you say, a wellness device, something that anyone, virtually at any age could be incorporating. I know in your interview you said there was no contraindications, and of course we know that.
correct.
That somebody could just be, integrating into their life on a daily basis. I mean, the protocol is twice a day, 20 minutes. Pretty simple stuff.
You have to remember this also, Duke. The importance of this is that what are you doing? You're pushing the microcirculation. You're pushing the oxygen in the tissues, right?
Right.
People injure themselves because the muscle is not at optimum. Say they had a hard workout the day before, and if they didn't have one of these machines and they go and they hit the machine again, right? And they can get a tear or something like that. This helps bring the nutrients back so that the muscles can recover. So that's why I think it's a good preventative device for someone who's going to be doing workouts and just wants to have it as, just a baseline. It's just one of those things. People go all the time. They take, different nutraceuticals or vitamins and things like that every day because it helps their system, right? Well, that's kind of what the Avicen kind of does. But here's the thing: if the machines that you're working out with is the computer, right? the Avicen is kind of like a part of that machine now. It's an adjunct for that machine. You're putting in the pin instead of putting your arms up and down, doing your traps, et cetera, and your delts or whatever. Here now you're using this machine on the inside of your body for the oxygen part of it to really push it through. And I think that's a really big point in which people may not have that area of where they could be injured from not having the oxygen and the muscle, lactic acid being pulled away, just to say a few things about it. So
right.
I think it's a very, very important device.
Thank you. So it sounds like even what you're saying, I mean, you're talking about people that are working out, which is great, but I mean, even people that aren't working out, or if their workout's just taking, a half hour to 45-minute walk every day, this could be something that they could be incorporating. Like you said, it's working from the inside. So why not, make sure you maximize that oxygen?
Yeah, absolutely. I mean, the oxygen is the key, right? I mean, if the tissues don't get the oxygen, you're not pulling away the CO2 and the other toxins, et cetera, and so forth, you're not going to do well. You know, so this is like a no-brainer for me, because there's no contraindications with it. I mean, what are you doing? I mean, Americans basically are pretty sedimentary people. A lot of them, remember that back in the old days, they would have the TV dinners and they wouldn't even make dinners. They would just put it in front of them. We've kind of moved from that. But if you can't sit down for 20 minutes and put your hand in a machine while you're reading a book or even watching the television, I mean, really, it's simplistic. It's not like we're telling people, okay, for 3 hours you're going to do this machine, or put them in a hyperbaric, or have them do these other things. I mean, this is really simplistic, easy for them to do while they're still continually doing something on the right hand, or the left hand's in and the computer's in the other hand, and you're doing other work and stuff. I mean, I'll share with you, I've got a bad back. I've been caged in December. I was in a car accident. I'll just share that with you. I was hit, they said approximately 65 miles an hour, and I was at a dead stop. So they caged my back. I've been utilizing the Avicen machine, okay? And my back's pretty good. And it's part of my routine now. I'm like working, and I just get my hand in there, and I'm just kind of doing my thing. So yeah, for me, it's just becoming part of that routine.
Perfect. Well, thank you so much, Ian. I sure appreciate you taking the time once again and sharing with us and sharing your wisdom and what you've experienced. So again, thanks so much.
My pleasure. And I want to thank everybody that's putting this together, Jamie and Bob and Bill and all of you have been very great sharing the information. I mean, it's all about share that information. And it's been great. So anytime I can help anybody, Duke, I'm there, because I've become a person that really believes in this technology. Once again, I tell my patients this: you have to understand the technology surpassing the medicine, and that's what the Avicen wellness device is doing.
Wonderful.
That's it. Yeah. Okay.
All right. I love your passion. Thank you so much.
Thank you, everybody. I appreciate allowing me to be able to talk with you today and share my experiences with it. Thank you very much.
Appreciate you carving out the time, Doc.
Bye-bye.
Take care.
Bye now. All right.
Wow, wow. Thank you so much, Dr. Goldbaum. I mean, every time I listen to you, I learn more and more. I knew we had a marvelous device here that was definitely something for everyone, but you really, your expansion on the many properties of this device is just amazing. So thank you for being part of this. Thank you, thank you, thank you. I'm sure everyone on this call this morning feels exactly the same way.